This episode of HIPcast is brought to you by Datavant. Datavant protects, connects, and delivers the world's most precious data. As the leader in data logistics for healthcare, they enable organizations to achieve their boldest ambitions and advance human health. Join Datavant in fixing the health data supply chain. Datavant securely and compliantly moves relevant health data from where it sits to where it needs to be. Great data logistics gives providers whole patient health data effectively assembled for specific requests and protected to ensure patient privacy. Built on decades of release of information expertise, their products and services create a frictionless experience for managing the flow of patient data. Datavant ensures relevant information is provided only to those who should have it. Learn more about Datavant's offerings by visiting www.datavant.com.
Well, Amber Epperson, welcome to the show.
Thank you for having me. I'm excited.
Yes. Yeah, we are very excited to have you. I had the great fortune to go to the Kansas Health Information Management Association's annual meeting where I met Amber. And when I learned that Amber did data quality for KANSA, who is a qualified health information network, or a QHIN, I said, "Oh, would you please come on our podcast?" And she very graciously said yes. So we're happy to have you on. I'm going to read Amber's bio, and then we're going to get started. Amber Epperson is a health information professional with over 2 decades of diverse experience across the healthcare ecosystem. Her work experience ranges from hospitals and home health to clinics and long-term care. Currently, she works for KANSA National Network, one of the nation's first health information exchanges to become a federally designated qualified health information network, which we affectionately call QHINs. Amber started her health information career as a medical record clerk and later advanced into roles including electronic health record technician, hospital, outpatient and inpatient coder, HIM supervisor, HIM coding manager, data quality specialist, and HIM director. Amber obtained her Associates of Applied Science degree from Hutchinson Community College in 2006, and later obtained her Bachelor of Science degree from the University of Kansas Medical Center in 2015. Amber holds credentials as an RHIA and a Certified Health Data Analyst, or CHDA, as well as a CPC from the AAPC. Amber's longstanding commitment to the health information field is evident through her years of service on the Kansas Health Information Association Programs Committee and past service as the co-chair of the KHIMA Information Governance Committee. Throughout her career, Amber has sought to acquire the foundational understanding of how data is structured, stored, and shared across the healthcare community. She has a passion for her data accuracy, efficiency, and process improvement, and has received a yellow belt in Lean Six Sigma for her work in reducing billing edits as a coding manager. In 2021, Amber and her team were featured in the RevCycle Intelligence for their work using rule-based coding to expedite the coding process for COVID-19 immunizations clinics in Lawrence, Kansas. In 2022, Amber decided to make a career pivot to bring her health information skill set to the world of HIE, Health Information Exchange, data quality. In her current role, she is dedicated to evaluating and improving the quality of data being transmitted to KANSA, regional HIEs, including HL7 and CCD data types. Her primary responsibility is to perform primary source verification and the HIE members to ensure data is supported and successfully meets the rigorous requirements for NCQA Data Aggregator Validator Accreditation. Wow.
That was a fun one. I read that one earlier and thought, wow, that one's going to be a fun one to read. I'm glad I'm not doing it.
Yeah, it's pretty crazy. On the personal side of things, Amber is a wife to an incredibly supportive IT guy and a mother to 3 incredible children ranging in age from 6 years to 10 months.
Whew.
I know congratulations. She enjoys being active by practicing yoga and does her best to incorporate mindfulness into her daily life while managing life as a working mom. She is incredibly thankful to be able to make a living loving what she does while working from home and learning new things every day. Amber, you are so, I said before we were talking about, having younger professionals on and definitely diverse skill sets. And you just look like you're not old enough to have been in this field for 20 years. I'm just going to call it out right now.
Well,
I'm
thank you.
surprised. So today we are going to talk about really all things data quality, health information exchange, and what is a health information professional's role in that. It's going to be a really fun conversation, I think, today. Maybe a little different. We have interviewed folks from a QHIN before, but this is a different view of that. This is a different lens, so pretty excited.
Absolutely. It was interesting. We always have a prep document that Shannan and I work through, and we never follow it. But it's a fun thing to work on, to have some structure. But one of the questions that came to mind when Shannan was going through your bio, Amber, was that we always ask our guest, or we like to ask our guest, is about your HI journey. And you started as a medical records clerk. Did you grow up as a little girl going, one day I want to be a medical records clerk? So how did you end up where how you started and where you end up now?
Well, I was probably an odd child. I loved looking at the phone book, and I was mesmerized by alphabetizing at a very young age. So I wouldn't say I knew medical records, but I definitely got my start early. I was in high school when I was introduced to medical records through a program at my high school. We had a program called Business Professionals of America. And that program allowed us to be interviewed by different employers in the community. So banks and, clinics, healthcare. We got to be interviewed, and I was actually offered a position in the medical records department of a clinic in my hometown. And I just kind of got started filing and putting charts away and pulling charts for appointments. And I was just enthralled by the organization of it. I love to do the chart audits to make sure everything was where they needed to be within the record, so that doctors and care providers, when they got that paper record for the clinic visit, they knew exactly where to flip to find the x-ray or the lab that the patient has had. So I loved it. I decided after doing some research, my hometown community college had a health information technology program. So it kind of came together pretty easily when I needed to decide my senior year what to go to school for. So I enrolled, and at that time, it was actually an in-class program. So I know a lot of folks now will do the online programs for the health information technology, but I was fortunate to be able to go and go to school while working in the field and getting that hands-on experience. It was invaluable in my learning, the putting everything together of what I was learning in school. We had the really thick ICD-9 at the time coding book that we were learning from and flipping, and you'd get the little add-ins to it. When the code books changed, instead of getting a whole new book, you get the little add-ins that you would add to the book. I got my associates, and then I just decided to keep working and keep learning, because at that point I was not sure about getting a bachelor's. I wanted to see where it would kind of take me at that time. So I worked for the hospital in my hometown for a little while, and then I moved to home health, and I got to learn a little bit about kind of how health information in the home health space works. So learning about the OASIS assessments and how that data is transmitted to CMS, Medicare, and at that time it was paper charts too, but we had kind of a hybrid. So I got to enter a lot of data into our computer system that was on paper. And then my next role was really kind of what got me more into the technical side of things. As a electronic health information technician for a long-term care facility, I was able to really set their EHR up when they first were going live with it. So building out all the forms, where people enter things from the, MDS perspective, I would design how those forms entered and how they communicated with the physician. I did document imaging and those types of things in that role too. And then I ended up moving to Lawrence when my husband and I decided to make a change, and he got a job out here. So I started at the hospital and as a coder. So then that kind of took me into various roles. But yeah, I have always really saw the opportunity in HIM and all the various areas that you could work. So I got into health quality at that time too, and learned about MIPS and promoting interoperability, which was another feeder into my HIE, kind of preceptor to what got me to where I am now. So being a coding manager and understanding the way that the quality of the entered data from the physician side impacts the coding side, and then downstream to the claims, and now to the big, HIE data. So
that's a great journey.
Oh my goodness.
We always talk about students we hope that students are listening to this. And if you're an educator out there, please encourage your students to listen to this podcast. Yeah. But the important piece that stands out to me is that it's a journey. You don't know necessarily where you're going to end up. You may have an idea of what you want to do eventually, but sometimes you got to start as the medical records clerk. Then you got to move to the next piece that opens your eyes to another side of the world. Then you go get the bachelor's degree. So it's a journey. It is an absolute journey through this profession, and it can take you on a fun ride.
Yeah, it is a journey, and I've got a couple of things that I want to call out here. First of all,
told you we wouldn't follow the outline.
Mostly these are just comments. First of all, if you doubted Amber's age, she definitely had some age-related discussion, because she talked about terminal digit. Basically, she was talking about terminal digit filing. She was talking about having to enter data into the system. So definitely she has proven that she is old enough to have this conversation.
That's right.
And then the other thing, I want to call out that you're a trendsetter, because you are the very first person that we have had the pleasure to interview that said, I knew in high school that this was an opportunity. Is it, there's nobody else, right? This is amazing.
Yeah, you're right.
All right. So Amber, I'm going to just say, whatever it was that gave you that path to understand what health information management was at the time, we need to revive that and move it across the nation into the high schools, because if we can get folks like you inspired that early, then we can address the aging out people, which I hope I'm an aging out person pretty soon, because I can.
Call it workforce shortage.
Okay, whatever.
The impending workforce shortage.
I'm going to be aging out, okay? That's what I'm going to call it. Y'all can be talking about a workforce shortage, but the reality is we have a lot of people retiring. So I want you to, maybe think about, how do we revive? Let's do a revival of that, because that's amazing. You're the very first. So you're a trendsetter, which is very cool. So for all that journey, the foundation that you just laid, talking even about the phone book and alphabetizing and organizing data and terminal digit filing and all of those components, and, how you enter data into the EHR, where it should be, what those forms look like. Talk to us a little bit about the common quality issues and some of the challenges in an HIE or health information exchange, and then just kind of where do you maybe see things progressing? This is kind of this wasn't on the prep either, but maybe how technology is playing a role in making that better or worse.
Yeah, of course. So the challenges are great and vast. I feel like there's always no shortage of challenges. But in an HIE space, the various EHRs that we have that we are working to validate the data for, the standardization, just like interoperability, getting everything to talk. We have a really great system for, onboarding our sites and making sure that the data that's coming in from the beginning meets the rigorous standards that we have set or that are set through various, government bodies and so forth. So the challenges are being able to get all of the codified data and the data that is being sent to be a common language. So like SNOMEDs are, we have a process that helps to what we call uplift the data. So if it's a SNOMED, it uplifts to ICD-10. If it's a local code, we have the ability to uplift a local code set. So like in the labs, if the EHR doesn't have the LOINC codes built into them, there's the ability to uplift those to a LOINC code. So there's certain, we have a whole list. So for example, like basophils, if we get a local code that says baso, we have the ability to uplift that to either basophils % or basophils count. So I've learned a lot in this new role or newish role. I've been here 2 years now almost, but to get the data to mean what it's supposed to mean in the EHR. So I learned more about LOINC in the last 2 years than I ever expected to. You learn about, these are the code sets that they use for different areas, CPT, LOINC. So some of the biggest challenges are just getting the local codes that are sent to index appropriately into the correct lab test so that when it's shared out to the end users, that number means what it says it is. So 0.6 is the %, or, that everything is reflected what it should be in the EHR. So when I'm doing the primary source verification, first meeting with the sites to support the data that is in the HIE. We like to see diagnoses, the problem list, the labs, the procedures that were performed. Sometimes another challenge is that the data point being sent may be the ordered date instead of the performed date. So the challenges are validating that, and that's important for HEDIS. So when the measures are being calculated, they're very specific. And so if the procedure was ordered on the 27th, but performed on the 28th or the 29th, that's going to potentially make that patient fall out or into a measure that they shouldn't for HEDIS. So those are some of the challenges. It's just making sure that the fields that are coming to us, the data points, are accurate to what the specifications in all the various manuals say that they have to be.
Yeah, it seems like the reconciliation process has to be pretty well defined for those ordered versus, for a lot of things. But
and that's across thousands and thousands of encounters, right?
So many. I did have one question before we move on. When you're talking about uplift, are you essentially talking about mapping? You're kind of taking the terms or the, okay, very good, very good. So you're taking just all of that standard language, local community or local facility, the way they document, and then you're bringing it forward into Concept, and then you're mapping it to the appropriate source. So there's a validation so that it can be exchanged. That's awesome.
Yes, that's right.
So let me boil this down further to where my brain works, because I'm a mountain person from East Tennessee, so I have to bring it down to the simplest level. I've always said that the struggle from an EMR perspective and interoperability is that standardization problem. For example, the example I always gave would be, I may call this a history and physical, to where you may call it an HPI, and somebody else may call it an H&P. So they don't talk. We can't make that information flow back and forth because we don't have a standard naming convention just for that one simple report. And then you multiply that against every data field, everything that's within the EMR that's related to that patient, to where just one simple character that's different between systems means that they don't map. Is that a fair assessment of where some of the challenges are in interoperability today?
I would say yes. There's a pretty robust data dictionary, that has those types of tags like this. for that basophil example I was giving earlier. So if we just receive like baso, BASO for basophils, the system will know, maybe not if it says baso, but it'll have to have like percent or absolute or
Yes, got it.
there's different terms that are built into the system to aggregate the data and bring it to the main level of what is expected for that lab test. So the LOINC code
Gotcha.
that is the one-to-one match. So yeah,
And that's at the HIE level, right?
That's at the HIE level, yes.
Wow.
So being able to recognize those terms and they look different across thousands of organizations, hospitals, clinics across the country. So we're spread out all across the nation. And so being able to bring in that data from various EHRs and uplift it to that common language that everybody expects, which is LOINC for labs specifically.
That's great. Well, I'm already learning things. So that's why we do this. So hopefully our listeners are also learning things. And it sounds like from a data quality perspective in an HIE, the HI professional plays a very critical role. Is that a fair assumption?
I would say, yeah, there's a lot of opportunity for health information professionals to lend their expertise. We're experts in CPT, ICD-10, LOINC, maybe not SNOMED, but you learn these things in school.
Awareness, right?
We learn what these nomenclatures and terminologies are for, and understand what they, not just what they're for, but what they mean in the record and how to interpret the information. And so, yeah, I would say it's a great skill set to have in the world of HIE to be a health information professional. Yes.
Yeah. And it sounds like there's one of the things that Shannan mentioned in the bio, the DAV accreditation, right? That seems like a big deal from an HIE perspective, and that allows health plans and providers to trust the information, right?
Absolutely. Yeah. It the validation that our data feed are high quality, the highest level of quality that currently exists in the nation today. So they use those standardized tools that I mentioned, like SNOMED, and they make sure that all of the information. So we perform what's called primary source verification. So that is basically a fancy way of saying we meet with the sites, we validate all the data points that are in the EHR that we have in our HIE, and we make sure that everything matches up line by line in the XML. So I've learned a lot about XML and what how to read it, the code, which effective dates and times mean what inside there. It's been very interesting. I've enjoyed digesting all of that technical lingo and being able to read an XML. I just find it very interesting.
I think my eyes would cross looking at all
the string of code. That's hard. I want to kind of ask a little bit of a technical and a process question, I think related here. Some of the, we probably should have done a level set for what a QHIN actually is, what a qualified health information network is. But I'll give a high level of what I know, and you can correct anything because I know this much, and my fingers are touching. That's how much I know. But essentially, there are it's to connect the network of networks and exchange health information across the nation, right? And so some of the health information, the QHINs, are repositories for data where they'll get data and they'll hold it, and then a query can happen or participants can get data. And then some are just kind of the transactional places. They don't hold data. They're just a freeway basically for a query to come in, and then they reach out and get the data and they push it, and they don't hold it. And so if your organization does both, do you hold and do you just do exchange? Do you do both of those things?
I believe just the former. So the
so
first
you're the repository.
Yeah.
Because I'm curious about the technical components. Data quality and validation would have to be the same, but I just wondered if you're an entity that holds data, but also if you're transacting data for other participants, is there a difference in that technical process workflow from a quality perspective? Holding it and exchanging it from a query based on just doing the transaction. I was just thinking as you were talking through that, how you would, that's two different streams, right? It has to be two different processes.
Yeah, if it's in our repository, if it's transactional, like it's not directly from our members, we would not necessarily, from a data quality perspective, that wouldn't fall under, my necessarily scope in the data quality currently. But this is all very new. Sure. So if one day it might, when it comes to certain aspects of the workflow, but at the current time, that's not something that is in my scope.
Yeah, that makes sense.
Well, it wouldn't be 2024 without asking, Shannan, maybe that's a place for AI, right? Is to look at this data and move things around, match them up. Because AI is really good at processing large amounts of data, right? So it may be an interesting place that AI is going to insert itself in the HIE world.
Yeah, that's a good observation. And, putting us as more of like an editor, or making sure that, a monitor of the system to make sure that the metrics
the AI is operating, right?
Yeah, it's operating correctly in the way that it's intended.
That's
for.
Awesome.
Yeah,
and we tell people, don't be scared. AI is not scary unless it becomes sentient and starts sending out fire-breathing robo-dogs.
Right. Then it's scary.
That's when it gets a little scary. But for the most part, it's a tool, right? It's something that we can apply. And it sounds like with an HIE, there's a future for that. And it also makes me wonder, what's the future for an HIE professional in the industry related to HIE? So any advice that you would give to, I would say, students or young professionals, or even professionals that are not aging out, as Shannan said earlier, but professionals that are thinking about a new career, a new pathway in their career towards an HIE. Any advice there?
I would say advice. Don't be afraid to ask questions, reach out to someone. I know when I was on the programs committee for Kahima, I was always like hearing HIE at the meetings and wanting to learn more. And so I reached out and I said, hey, will you come speak at our annual meeting? And so getting more information, just diving in. And then, if you see a position posted and you think you could have that skill set, just jump in and see. I feel like it's been a really interesting transition for me to get to learn about what an HIE does and how the skill set I have was a smooth transition into this world. I would say from a education standpoint, I've been interested in Smart on Fire. So learning more about fire data, and because I know that is the new, it's been the new thing for a while, but being able to kind of get into that, I find that to be really interesting, having those resources that can have that data sets pre-programmed that you can easily pull from and make things more efficient. That's my efficiency and process improvement mind flowing and what can this do? So as far as students go, just don't be afraid to ask questions, reach out to people and have those conversations if you're interested. I've always really enjoyed talking with students who are new to HIM or interested in HIM, just to share what I know. And I don't think I've ever met an HIM professional who hasn't been, supportive of
That's right.
students. And
it's a good network. HI professionals and the HIM industry is an incredible network. And I know we've covered it, Shannan, on several of our episodes, but it just truly is a family. And it doesn't matter if you're at the Tennessee show or if you go speak like Shannan did to Kansas and runs into Amber here. It's like, we're just one big networked community. And that's what I hope students understand and they dive in. You mentioned that in your school that you're in one of the last programs that was in person, and a lot of the programs today are online. I too, in my HM school, was in one of the last in-person programs. And I look back on that like that was so good. I'm glad that it was in person and not online, because you build that community, you build that network.
Yes,
Yeah,
it's very
absolutely.
it's very true. I'm so old that we still had to walk to school uphill both ways in the snow too, when we were in person. But no, I'm kidding. I'm a late bloomer. I went to school late, but I was in person. Seth, I want to thank you for keeping us out of trouble, because it's illegal to have presentations or podcasts without saying AI, and you said AI, so now we're legal. Now we're legal. And but also, Amber, just as a closing thought from you before Seth closes out, one of the things that Seth and I did a panel, gosh, this has been a couple of years ago. We were on a panel discussion at the Tennessee annual meeting. And we had a lot of young professionals and students in the room asking us just all kinds of questions. We kind of told our journey, then we had them asking us questions. And there was one guy, Seth, you did such a good job answering this question. There was one young, new to the profession. He was in his first job, and he asked about imposter syndrome. And he said, I know I'm not fully equipped or fully qualified. He was equipped, but fully qualified to do this job that I'm doing now. And he said, how do you not face imposter syndrome? And, Seth's response, I think, was something there was a few Sethisms in it, I'm sure. But, he said, I think we all live partially in imposter syndrome every time we make a change. And that is so true. In fact, I kind of feel like if I'm not living in an uncomfortable place where I feel a little bit of imposter syndrome, that I'm not growing. So can you maybe speak to, just before we hand it back to Seth to close, could you maybe speak just a little bit to young professionals or even seasoned professionals who really are just tired of doing what they do and they want to do something else, but they're afraid, they're not emboldened to take that step? Speak a little bit to, how do you get past that fear of imposter syndrome to move into something and learn something new?
That's a really good question. And I'm glad you asked that, because I feel the same way. I feel like everything you just said, with being in a position where you're a little nervous about something, is this, your mind gets going with all these hypotheses of things that could happen. I had advice once that was given to me. Anytime I feel, nervous, or, that there's something that I want, but I need to get over this, hump of my own thoughts or my own brain taking over, is confidence and enthusiasm. So if you have confidence and if you have enthusiasm, you know that it's something that interests you, and you want to try your hand at it, knowing that with practice, with dedication, you can do anything. And so I think that trying to shut down those thoughts of being an imposter, and just knowing everybody's out here trying to do their best. There are times where I see that within myself too. And
that's a much better saying than what I normally say, because I always say 90% of what I say is with confidence, not accuracy. So for the students out there, listen to Amber, not Seth, because he's kind of
right. And the
instruction
confidence, not necessarily the confidence that I have everything I need to do this job, but the confidence to know that I can learn to do this job. Right.
That's right. Yes. The
right.
confidence that you can learn.
That's awesome.
And yeah, I think that
absolutely
it's important to recognize that we all have to start somewhere.
Yeah, we do.
And yeah.
Exactly. That's great advice. Well, Amber, this has been an absolute pleasure. It's been eye-opening for me to learn more about the HIE world and data quality around that. So thank you for being a guest here on HIPcast. And I do want to thank our sponsor that brought this episode of HIPcast today, which is Datavant. Datavant protects, connects, and delivers the world's most precious data. As the leader in data logistics for healthcare, they enable organizations to achieve their boldest ambitions and advance human health. Join Datavant in fixing the health data supply chain. Datavant securely and compliantly moves relevant health data from where it sits to where it needs to be. Great Data Logistics gives providers whole patient health data effectively assembled for specific requests and protected to ensure patient privacy. Built on decades of release of information expertise, their products and services create a frictionless experience for managing the flow of patient data. Datavant ensures relevant information is provided only to those who should have it. Learn more about Datavant's offerings by visiting www.datavant.com. Shannan, until next time, my friend.